Well, today in our Align Patterns and Solutions home series, we are going to be talking about rhomboid pain. Most of you know it as pain between your shoulder blades. It's that little knot that doesn't like to go anywhere. So we are going to learn how to understand your pain and change your pattern. Of course, we always have to have this disclaimer. This video is for educational purposes only, and these techniques are adapted for safe home use and are not a substitute for professional medical care or licensed bodywork. If you have an injury, medical condition, or are unsure whether this is appropriate for you, consult a qualified healthcare provider before attempting to do this. And this is not to be construed as medical advice, a substitute for licensed massage therapy. You assume responsibility, and if pain increases, please consult a physician for chronic conditions. So before we jump in, I just want to give you a basis. I really want to share this with the general public and give you some at-home options to help yourself. In order to do that, I want you to understand what Align Patterns and Solutions is. This is the home version for what I call Pain Patterns and Solutions. Pain Patterns and Solutions is an advanced pain management massage therapy technique, so we have made this very doable at home, but it's an approach on how to work with chronic inflammation that is causing pain by working with the tissue inflammation creates. It's scar tissue. And right there is the biggest difference between what I'm going to teach you today and what we normally look at. I'm going to ask you to work on scar tissue, not muscle, to change muscle. Scar tissue forms for injury and repair, but it also forms for balance. And scar tissue forms in pairs. And I think that's the biggest thing to understand with this particular approach is that you are dealing with equal and opposite reactions. So there's two forces to every pain that you're going to be working with. And all scar tissue responds to the laws of physics and gravity, which is why for every action, there's an equal and opposite reaction. Scar tissue likes to form on bony landmarks, ligaments, large fascial planes, tendons, pretty much anything that can be an anchor. And this is where you're going to find the solutions to chronic inflammation and pain. So if you have been working with muscles and muscles are not changing, then you are not dealing with a muscular problem. You are dealing with an inflammation problem. And the tissue that inflammation builds is scar tissue. And so to truly resolve what's going on with the muscles, we're going to head into the scar tissue system. I also want you to understand that rhomboid pain is part of what I call a reversal force pattern. This is basically a compression force. This is how your body goes down towards gravity. So this is a downward pressure. In what I call the pain hierarchy chart or the pain force chart, there are other forces. And those other forces are actually a little more important than reversal forces. So if you go to work on your body today, and this technique doesn't work for you, but you have like SI joint dysfunction or TMJ or bulging disc syndromes or tennis elbow or shoulder issues, all of those rank higher than this pesky little trigger point in your back. So realize that while you can get rid of this pain, it may actually increase your pain somewhere else because it's not addressed in order. Now we're going to dive in and talk about this little pain point and the solutions. The way I like to visually show pain and solutions is, of course, your pain is in red, trigger points or decreased range of motion or headaches or whatever it is, but the solution is always in blue. Solution means scar tissue. As you watch through more videos, I just want you to realize that red and blue have a meaning behind them, and that is for you to understand the difference of where the pain is, but where the pain's coming from, and that's in blue. And your solution for the rhomboid trigger point is going to be the IT band, either the anterior or posterior edge. And in order to understand how to work this, I'm going to take you through a couple of videos. These are older videos, but they explain things very well. So don't mind the quality. And I'm going to go ahead and play those, and then I'm going to give you just a little bit more information at the end. Now we're going to show you how to do the poke test on the IT band so that you know how to do the work correctly for the rhomboid trigger points. So it's a really fast check. Remember that you're not going to be on the opposite side of the body like I am. And you also need to remember that you're only going to be doing this work on one side or the other of the IT band, not both. That's why we check. So what you're going to do is you're going to find the IT band like I've done right here. I've drawn it for you. It's really easy to find on somebody. If you come about in the middle of their leg and you start rolling back and forth, you're going to feel a line there, and that is the IT band line. So that's going to be one place that we're going to be doing this check. You need to find the same place on the front side. Find where that line is on the IT band as it comes into the quadriceps on the front. So you have these 2 points right here that we're going to use. What we're going to do is at a pressure level of about 6 or 7 on a 10 scale, we're going to push in on the front and in on the back. Then we're going to ask our client which one still feels like my finger's there and it's lingering or burning, and they should be able to tell you which one it is. As you're checking through the IT band, what you're going to find is that one side will burn and one side will not burn. The burn is only the indication to tell you which side to not work on. So let's go over this concept. If someone has what's called a posterior pelvis, and we're going to be using that posterior IT band to do work with the rhomboid reverse trigger point technique, what you need to understand is that for this person, their hamstrings are shorter, which means the quads are longer. It's a kinesthetic relationship. The IT band is going to be more comfortable to work on the hamstring side. It is only going to burn if you try and work on that anterior side. So we're going to select the posterior side, the non-burning side. So these clients will burn on the front of that IT band, and it's only telling you to not work there. So make sure that you stick to the back side or the posterior side of the band when you're doing the correlation work between the rhomboid and the IT band. On the flip side of this, the anterior pelvis IT band work for the rhomboid reverse trigger point technique, the quadriceps are going to be shorter, which means kinesthetically the hamstrings are going to be longer. The IT band is much more comfortable to work on the quadriceps side. So you're going to be working on the anterior side, the non-burning side. So these clients will tell you the burn is on the back of the band, which means we're going to work on the front. We're not going to work on the burn. Now, if for some reason this person burns on both sides, you're going to have to use your touch perception to understand how to work with them. And so you're going to have to rest your hands on the rhomboids, and we're going to learn this hands-on work in just a minute. You're going to rest your hands on a heightened area or a trigger point area in the rhomboid, and you're going to work a little on the posterior side of the band and check for change in the rhomboid. And then you're going to work a little bit on the anterior side of the band and check for change on the rhomboid. And you're going to have to determine which one actually takes the pressure off more on that rhomboid and use that side of the band. Now, but this typically happens when the client has more complicated issues going on in their body. There's a lot more pain going on inside their body than just rhomboid pain or basic back pain. So the IT band work for the rhomboid trigger point may not work for these clients until more is resolved elsewhere. So if it truly is uncomfortable for your client to receive this work, then go ahead and not do this work, and we'll move on to something else. Now we're going to talk about how to determine if your client has an anterior or posterior pelvis. So the first things I want to point out to you are the landmarks that we're going to use to understand the anatomy of the anterior or posterior pelvis. So the first thing I'm going to show you is, in order to understand which direction the pelvis is tilting, either forward or backwards, we have to use 2 landmarks. The posterior superior iliac spine, also known as the PSIS, and then we have the anterior superior iliac spine, also known as the ASIS. So what we're visually trying to determine is whether these 2 points are directly across from one another, or whether they're actually on top of one another. So this one's going to be higher and this one's going to be lower, or if it's reverse of that, where this one is higher and this one is lower. In order to understand how this fits into the IT band, I've actually put the IT band here on the skeleton so that you can see how things are going to work. And then we're actually going to show you on a live body how that pelvis is tilting and what the IT band is doing. So when you have somebody who is in a neutral status, meaning that the PSIS and the ASIS are directly across from one another, then you have something that's level and it's called neutral or 0. If you have a person who has the ASIS, which is lower than the PSIS, you actually have a tilting forward of that iliac crest,
which makes them anterior. So you have the pelvis actually shifting in an anterior capacity. And then if you have somebody who has the PSIS, which is lower than the ASIS, then you have someone who's tilting into what's called a posterior capacity. So that pelvis is tilting backwards. So the IT band attaches from the ASIS along the iliac crest to about 3/4 of the way back. Doesn't go all the way back to the PSIS, just about 3/4. Then it's going to actually free float over that hip, that femur, that head of the femur right here, and that is actually part of its job, is to hold that femur in when you're walking or running or sitting. Then it's going to come down and attach to the tibial bone right here. That's why it's known as the iliotibial tract. So when somebody has an anterior tilt going on, what's going to happen is that as this pelvis moves forward, that IT band is going to be a little shorter in the front, but it's going to be a lot longer in the back. And that is part of what we're looking for when we go to do work with scar tissue, is we want where it's short and comfortable and stuck, and we want to take some length out of there and balance the pelvis. So when you have someone who's posteriorly rotated, where the PSIS is traveling down and the ASIS is traveling up, then it actually starts to shorten up here in the back and lengthen out here in the front, right here. So again, that's what we're going to be looking for, is areas where it's short and stuck, so that we can take the pelvis and balance it back to neutral again. Now we're going to show you on a live body how that angling works with the anterior superior iliac spine and the posterior superior iliac spine. So let's go into an anterior pelvis posture. So you're going to see that the ASIS is lower in the front and the PSIS is higher in the back. And I'm going to put this pencil right here so you can kind of see that angle and how it's going forward. All right, now we're going to go into a posterior rotation where the PSIS is down and the ASIS is up, and you can see how that kind of goes into that posterior rotation, how you're starting to see that lean backwards. All right, let's go to neutral. There you go. So now I'm going to show you what that IT band is doing when he's in those positions. So go ahead and go anterior again. You can see how we're starting to get some slack here in the front, and the body's going to pick that up, and then it starts to get really long here in the back. Go into a posterior. Good. You can see how we're getting all this slack here in the back, and it's lengthening out through the front. And this is where the body is going to have that scar tissue forming and holding and locking things up in that direction. Now we're going to go over the hands-on work for the rhomboids. The first thing I want to do is to just redefine our thirds that we're going to be working with. For the rhomboids, we have an upper third, a middle third, and a lower third. And for the IT band, we have an upper third, a middle third, and a lower third. For this video, we're going to be using the posterior side of the IT band for this particular client. So the first thing that you're going to do is you're actually going to come up and assess the trigger points in the rhomboid. You're going to look for the tightest or the highest area inside that rhomboid, and we're going to start here in the middle for this person. And then we're going to go into the correlating area into that middle third of the IT band. So what we're going to be looking for is, on the IT band, we want to find the area that's the thickest or the tightest or has the most bound feeling compared to the tissues around it. At the same time, we are going to be feeling for change inside this rhomboid. Now, I don't want you to trigger point this rhomboid. I want you to just feel for change. We're going to come down into this middle third area, and I'm going to go along this edge of the IT band. Now, I've drawn some areas that represent scar tissue development along that band, and that's kind of what they feel like. And so we want to feel for those areas that feel stuck or thick or non-moving compared to the tissue around it. So rest your fingertips on that area that has that tight feeling. Come down into this IT band and go right along the edge of that band until you feel your fingers sink. Then we're going to continue to work on the IT band and feel for change. And we want to continue to do that until we feel that rhomboid change completely. The next thing we're going to do is we're going to come up and reassess. Now, you can have a lot of different orders that the trigger points will release in. It's not necessarily a 1, 2, 3. It could be a 2, 3, 1. It could be a 1, 3, 2. You have to follow what the body tells you. For this person, we're going to go up here into that first third, which is going to be in this first third of the IT band. And we're going to do the same thing. Rest our fingertips and walk down that edge of the IT band until we find that area that takes the pressure off of our fingers in the rhomboid. Then we're going to continue to work that area and break that scar tissue down until we feel the change that has occurred in our hand up here in the rhomboid. Then we're going to come in and reassess again and find an area that needs work and come down and do the same thing, feeling for change with the hand that's on the rhomboid and feeling for areas that are stuck on the IT band until you create that change. Now, you may end up going back and doing another area again. You just have to follow what's going on inside this area. So continue to do this work until you create change up through here and you have relieved that pressure down through that IT band to create that change.
Now that you've seen the direct correlation, as I call it, how to work the IT band and how to change the rhomboid trigger points, I want you to know that reversal force has 3 components. Now, remember I said there's 2 pieces of scar tissue for every pain pattern. In this instance, there's 2 pieces of scar tissue, but the 2 create such opposing dynamic forces and they put so much pressure on the middle, kind of like a tug of war where you have one end pulling one direction and one end pulling the other, and the middle has so much force that the body lays down scar tissue to balance out those forces. And that middle is your IT band. And that's where you get those rhomboid trigger points. So I'm going to take you through this video that shows you how this forms so that you have not only a short solution, but also a longer explanation. The one thing I want you to understand when you're using the IT band to change what's going on between your shoulder blades, you're only accessing a portion of what's really going on inside the body. So when you talk about pain patterns and solutions and how this really changes, you have to understand what created the scar tissue in the IT bands to begin with. So I'm going to give you a very short demonstration of how this works. Reversal forces have to do with everything that goes downward. This is a compression force. So what happens is if somebody has, and this can be in either order, it's going to end up exactly in the same place. But if somebody has a head injury or they've done something where they've had any type of injury that creates scar tissue cannot be an unbalanced force because for every action, there's an equal and opposite reaction. In reversal forces, you're going to have scar tissue that forms in one end, such as the head, and then you're going to have scar tissue that forms in the opposite end to balance. And like I said, these can be in either order. You can have some ankle trauma or broken toes or whatever, but that force is going to balance from top to bottom. Because when you have these types of forces, anything that goes towards scar tissue shortens, you actually have, and this is a visual anomaly, you actually have a shortening force that is going into the scar tissue in the head. And then you have a shortening force that's going into the scar tissue forming in the feet. And what happens is in the center of all of this, you end up with what I call like the tug of war. So there's a lot of force in that center. And because there's force in that center, what the body's going to do is it's going to start to lay down scar tissue in areas that will stop that. And one of the places it likes to do that is right here in the IT bands. Because what it does is it creates this balance between the head, the foot, and a stabilizing force in the middle. So then you see these different forces. The other place it's going to lay down is it's actually going to put some scar tissue down here on the sacrum, which we'll talk about in some other videos. So what you're seeing is kind of a completed opposition of forces. And when you have this completed opposition of forces, everything is finding its balance. You're going to see these rhomboid trigger points show up. There's actually a couple different back patterns that you'll see, but this is telling you that the body has found balance. These are some of the first trigger points to show up. They're also some of the last to leave because they show you that you're dealing with forces in 3 areas that have to be eliminated at the same time. So if you want to truly get rid of rhomboid trigger points, yes, there's a quick solution from the IT band that can change that, but the IT band exists because these other 2 platforms exist. So when you're looking at the holistic approach to really truly getting rid of these particular pain patterns, the full body approach that creates the greatest change involves working through scar tissue that forms in the head, which you'll find anywhere in the cranial fascia, some of the structures of the face, the chin, even the clavicles if they've been broken. And then you'll also find it in the bottom of the feet because it either began there or it balanced there. And then you have those IT bands, and those IT bands will resolve pretty much by themselves if the forces in the head and the feet are gone. When you go to use this IT band release, where you're using like the top third, the middle third, and then the bottom third to get rid of those, and you're either doing the anterior edge or the posterior edge, you will be able to get this IT band to relieve these trigger points for a couple of times. But then they will come back a little stronger if you don't actually eliminate the reason they began. And I tell you this because I have people who watch these videos and I think, oh, wow, this is a really cool trick. And I can get the IT band to let, the shoulder blade pain go away. It works about 3 times and then it starts to get a little worse. And it's not because you're doing anything wrong. It's because it's part of a bigger process than just this short distance release technique from the IT band to the rhomboid. If you want to understand this whole process, then watch the videos that talk about reversals or watch the videos that talk about how to work with the facial structures and the craniofacial and also the scar tissue that forms on the feet and into the ankles. So now you have a direct correlation, but also a full body explanation as to why you can get the rhomboids to change through the IT band pattern.